Combat Reality Target Guide, Where to Hit When It Matters. Introduction. The following targets are what you need to learn to attack and why. Whether you're using a hand strike, punch, kick, weapon of opportunity, or a defender, all of these might not be available to you. You must understand this limited set of targets so you can take advantage of them in a chaotic fight. Eyes. An eye injury can result in outcomes ranging from minor irritation to severe, vision-threatening conditions. The severity depends on the force of impact, whether you used a fingernail, fingertip, or the sharp point of a defender tool, and the exact location of injury. Medical consequences include corneal abrasion, most common injury. Scratching the clear front surface causes extreme pain, feeling like something is stuck in the eye. Symptoms include redness, watery eyes, light sensitivity, and blurred vision. Subconjunctival hemorrhage ruptures small blood vessels, causing dramatic bright red patches on the white of the eye. Looks worse than it is, but creates panic. Traumatic iritis, direct blow causes iris inflammation. Results in severe eye pain, light sensitivity, and pupil shape changes. Hyphema, forceful injury causes bleeding inside the front of the eye. Blood settles at the bottom of the iris and pupil. Can lead to dangerous eye pressure increases and permanent vision loss. Retinal detachment, severe cases can cause the retina to tear or detach. Medical emergency causing permanent vision loss. Symptoms include sudden floaters, light flashes, or dark shadows in vision. Orbital fracture, extremely forceful blows can fracture bones surrounding the eye, causing pain, swelling, bruising, and double vision. Combat result, can blind the attacker, potentially ending the engagement altogether. If your strike removes the eye from the socket, it hangs on the optical nerve. Without further attack, this ends the fight, they lose the ability to stand and will vomit as the brain can't determine which eye to use for equilibrium. Temple. A broken temporal bone pressing into the brain is a depressed skull fracture, a medical emergency that can be life-threatening due to the temple's location near vital structures. Medical consequences include intracranial hemorrhage, the temporal bone overlies the middle meningeal artery. Fractures can tear this artery, causing rapid blood accumulation between skull and brain. Called an epidural hematoma, this increases brain pressure and can quickly become fatal without surgical treatment. Direct brain injury, bone fragments pressing into brain tissue can damage the temporal lobe, leading to cognitive problems, memory loss, language difficulties, and personality changes. Seizures, trauma disrupts brain electrical activity, causing immediate seizures or developing post-traumatic epilepsy later. Facial nerve damage, the facial nerve passes through the temporal bone. Fractures can sever or compress this nerve, causing facial paralysis and drooping. Hearing and balance issues, inner ear structures within the temporal bone control hearing and balance. Injuries cause hearing loss, tinnitus, or vertigo. Cerebrospinal fluid leak, fractures that tear the dura mater allow brain fluid to leak from the nose or ear, creating infection pathways and meningitis risk. Combat result, leads to cognitive problems, memory loss, language difficulties, and personality changes. Immediate incapacitation likely. Throat. A strike to the throat is extremely dangerous because vital, delicate structures lack bone protection. Results can be immediate and severe, primarily revolving around airway obstruction risk. Medical consequences include laryngeal fracture, direct blows can fracture voice box cartilage, immediately creating unstable airways. Airway obstruction, most serious immediate threat. Fractures can cause internal swelling, bleeding, or displaced cartilage, which blocks the airway and leads to suffocation. Victims have difficulty breathing, make high-pitched strained sounds, or show choking signs. Voice changes, vocal cord damage causes immediate and lasting voice changes, hoarse voice, or complete inability to speak. Tracheal injury, windpipe tears or ruptures cause air leaks into surrounding neck and chest tissues, creating crackling sensations under the skin. Vascular and nerve damage, severe blows can damage major blood vessels or nerves, leading to strokes, blood clots, or paralysis. Combat result, medical emergency requiring immediate professional attention. Any breathing difficulty, voice changes, throat pain, or swelling needs immediate care. This injury will end the attack event. Minimum effect. Most often, a strike will result in the violence stopping immediately. However, depending on the amount of damage to the throat, they can die within 4 minutes. Minimum time to stop violence, immediate. Maximum time to death. This depends on several factors, but if they have a crushed windpipe and can't take in oxygen, death will occur within 6 minutes. First, the struggle to get air, and panic sets in about 2 minutes after the strike. They lose consciousness at the 3 to 4 minute mark, and they are dead within a total of 6 minutes from the initial strike. Carotid artery. A puncture wound to the carotid artery is extremely serious and life-threatening. These major neck blood vessels supply oxygenated blood to the brain under high pressure, making punctures devastating with rapid consequences. Medical consequences include massive hemorrhage, most immediate threat. High-pressure blood causes rapid, forceful gushing. Life-threatening blood loss occurs within minutes, leading to hypovolemic shock and death without immediate intervention. Stroke. Puncture wounds damage the artery's inner lining, potentially forming blood clots. If clots break off and travel to the brain, they block smaller vessels, cutting off the blood supply and causing strokes. Air embolism. Open wounds can suck air into arteries. Air bubbles traveling to the brain block blood flow, which can also cause strokes. Nerve damage. The carotid arteries are located close to important neck nerves. Puncture wounds can damage the vagus nerve and facial nerve, causing various neurological problems. Combat result. Medical emergency requiring immediate professional care and often surgical repair. This result should bring attacks to quick ends. Minimum effect. The puncture will cause an immediate response. Fight over in mere seconds. Death can occur within 1 minute, depending on the wound damage. This damage usually leads to bleeding out to unconsciousness with death soon to follow. Minimum time to stop violence, immediate. Maximum time to death. This can be as short as 20 seconds. Bony areas. Strikes with concentrated force to bony areas can be very dangerous. The focused force on small surface areas against hard bones causes significant damage. Severity depends on strike force and the specific bones hit. Targets include the head, the back of the hands, the fingers, the knees, and the elbows. Medical consequences include bone fracture, most direct result. Concentrated force can exceed bone strength, causing clean breaks, splintered fractures, or depressed fractures. Periosteal contusion and hematoma. The tissue covering bones is rich in nerve endings and blood vessels. Direct strikes cause painful bruising and blood collection, leading to significant pain and swelling. Soft tissue damage. Impact damages skin, muscle, and covering tissues, resulting in deep bruises, cuts, or crush injuries. Nerve damage. Many nerves run along bone surfaces. Strikes can compress or damage nerves, causing intense pain and potentially numbness, tingling, or function loss. Joint damage. Strikes near joints can damage ligaments, tendons, or cartilage, causing sprains, dislocations, or serious joint fractures. Internal organ damage. Strikes to protective areas like ribs or skull can transmit force to internal organs. Rib strikes can cause fractures puncturing lungs. Head strikes can cause traumatic brain injuries. Combat result. Hand strikes cause tremendous pain but might not immediately stop attacks. However, injured hands won't be used for further attacks against you. Minimum effect. Breaking the bones in the back of the hands usually stops the attack, but it might not be over. They typically grab the injured hand and back up. At this point, they will be very vocal with you. The pain takes 0.3 of a second to reach the brain, and it is at that point that they usually back away and express their displeasure vocally. Minimum time to stop violence, immediate. Maximum time to death. However, if you inflict more severe damage, death can occur within 1 hour. Groin. Attacks to the groin area, particularly combining strikes and squeezes, are extremely dangerous due to reproductive organ vulnerability. Medical outcomes are severe. This is a medical emergency. For male victims, testicular contusion. severe bruising causing intense, debilitating pain, significant swelling, and discoloration. Testicular rupture, protective layers rupture, causing internal contents to spill out. Critical injury requiring emergency surgery, delayed treatment can result in testicle loss. Testicular torsion, trauma can trigger the testicles to twist on the spermatic cord, cutting off the blood supply. Excruciating condition requiring emergency surgery. Hematoma, significant blood collection in the scrotum, causing severe swelling and pain. For female victims, contusion and hematoma, bruising and blood collection in labia area, causing painful swelling and discoloration. Laceration, soft tissue tears requiring medical stitching to stop bleeding and prevent infection. Internal organ injury, forceful blows can potentially injure the bladder or urethra. Combat result, causes severe physical pain, potential long-term complications, and significant psychological trauma. High likelihood of stopping aggression directed toward you. Minimum effect, most often, a strike will result in the violence stopping immediately. Minimum time to stop violence, immediate. Maximum time to death, this depends on the severity of the damage. Internal organ injury or massive bleeding will bring death within 30 minutes. Knees. Kicks to knees commonly cause injury. Specific outcomes depend heavily on impact direction and force. The knee is complex, blows can damage bones, ligaments, tendons, or cartilage. Front knee kicks. Patellar fracture, sufficient force breaks the kneecap. PCL injury, forceful blows drive shin bone backward, potentially tearing posterior cruciate ligament. Side knee kicks. MCL or LCL tear, side kicks damage collateral ligaments responsible for side-to-side stability. Meniscus tear, side force causes bones to rotate against each other, tearing cartilage shock absorbers. ACL tear, severe impacts can stress and tear the anterior cruciate ligament. Back knee kicks. PCL tear, direct blows push shin bone backward, tearing posterior ligaments. Knee dislocation, severe cases cause complete joint dislocation, life-threatening due to potential artery damage. Nerve damage, can injure nerves behind knee, causing problems like foot drop. Combat result, might not stop attacks immediately but severely slows them down for escape. They'll stop pursuit quickly due to severe knee injury. Minimum effect, immediately, they can't use that knee after the kick or strike. However, depending on the damage, you know they will have a long recovery time. Minimum time to stop violence, immediate. Maximum time to death, little chance of this. However, if attacking their stability leads to them falling, other life-threatening injuries could be encountered. Top of head. Blows to the top of the head with concentrated surface objects are extremely dangerous. Force focuses on a small area, increasing the likelihood of skull fractures and traumatic brain injury. Medical consequences include scalp laceration and contusion, significant cuts and bruising. A rich blood supply means even minor cuts can bleed profusely. Skull fracture, most serious immediate risk. Concentrated force breaks bones, linear cracks, or depressed fractures where skull pieces push inward toward the brain. Traumatic brain injury, force transmits to the brain, causing concussions, brain contusions, intracranial hemorrhages, or cerebral edema. Combat result, high risk of skull fracture and severe traumatic brain injury. Likely ends attacks against you due to immediate incapacitation. Minimum effect, immediately, the least impact will be that all aggression stops, as they become unstable in standing, thinking, and other areas. Minimum time to stop violence, immediate. Maximum time to death, death can occur within 3 minutes or less, depending on the amount and type of brain damage. Top of foot. Significant foot injuries result from both crushing arch forces and strong kicks to foot tops, with different outcomes due to different anatomical structures. Arch crushing. Plantar fascia rupture, crushing blows tear tissue supporting the arch, causing extreme pain and weight-bearing inability. Tarsal bone fractures, arch bones can fracture or dislocate, leading to long-term pain and deformity. Top foot kicks. Metatarsal fractures, Most common result breaks long bones connecting ankle to toes, extensor tendon damage. Tendons lifting toes can be bruised, torn, or ruptured. Contusion and hematoma, deep bruising and blood accumulation causing severe swelling and pain. Combat result, attackers might not be able to continue attacking, chasing, or might lose interest in anything you do to severe foot injury and mobility loss. Minimum effect, immediate. Minimum time to stop violence, immediate, and it could worsen significantly within a few minutes. All good reasons to escape. Maximum time to death, unless there are secondary deadly injuries from this initial attack, death will not occur.
People have taken this to the airport because it's plastic, okay? It is called the Defender. It was created by Master Peter Brousseau. I believe he served in Vietnam and has over 20 confirmed kills. He realizes that people with special forces, he realizes that not everyone carries knives and guns, and so he created something that people can use. Okay, so the pointing part, for instance, Hector comes up and he's choking. The pointing part, I could put this anywhere. You see how his face is? And he wants to let go. But this part, I can crush and break. I can push down, which leads to that. Which leads to places here. I won't push because that's painful. That's a pressure point there. Also, you can knock out teeth. Under there, here, here, okay? So anywhere I go, he's choking me, I can go up to his neck. Look, that can do some serious damage. That can go to the eye, it can go to the ear, it can go behind the ear, it can go there. I can really do control and damage with that. Now that's simple, okay? If I wanted to take it up a notch, and Hector, can you all see? Okay. Jonathan, come there, buddy. So I'm doing a lot of grabbing and choking because we see that a lot with women, okay? So he grabs, boom, straight to his sternum. He wants to rip back, but I locked him in. With your tool, try to pull back. Cool, boom. Now, when he's going back, look what I'm gonna do. Again, he grabs, boom, look. He doesn't like that. He doesn't like that, right? He doesn't like that. Boom, he doesn't like that. I grab his finger, look, his finger's in there. He doesn't like it. This way. On your knees, please. Stand up, please. Scratch your butt, please. Digits are pain. Give it up for Hector.
Summary. These targets represent high percentage options that work regardless of your size, strength, or training level. The key is understanding that each target has specific medical consequences that can immediately change the dynamics of an attack. Choose your targets based on accessibility and your exit strategy. Some stop the fight entirely, others create the distance you need to escape. Remember, the goal is survival and escape, not causing maximum damage. Use the minimum force necessary to stop the threat and create your opportunity to get to safety. Legal disclaimer. Important legal notice: this educational content is provided for legitimate self-defense training purposes only. All techniques and target information are intended for use solely in legally justified self-defense situations where you reasonably believe you or others are in imminent danger of death or serious bodily harm. Our training philosophy is minimum necessary force. We teach the principle of using the minimum level of force necessary to stop the threat and ensure your safety. However, minimum necessary does not mean ineffective. As we cover in our courtroom defense video, doing too little damage might not stop the attack, putting you in greater danger and potentially requiring more force later. Key legal principles we teach. Assess the threat level to match your response to the violence being used against you. Apply effective force, ensure your defensive action actually stops the threat. Reassess continuously after each defensive action, determine if the threat has stopped, seek escape opportunities, use the time created by effective defense to get to safety. Stop when safe, cease defensive actions once the threat is neutralized where you can safely escape. Important, we train you to strike targets effectively until the threat stops, then immediately reassess. This may require multiple strikes to the same target area, depending on the attacker's response and the level of violence they're using against you. You are legally responsible for understanding your local and state self-defense laws, using force proportional to the threat you face, stopping defensive actions when the threat ceases, attempting to escape when safely possible, seeking immediate medical attention for all parties when safe to do so. This training does not authorize offensive or aggressive action, replace professional legal advice, guarantee legal protection for your actions, apply universally to all jurisdictions. Remember, in court, you want to demonstrate that you used thoughtful, measured force enough to ensure your safety, but not excessive. Our training prepares you to make these critical decisions under pressure while staying within legal boundaries. By viewing this content, you acknowledge that you understand these limitations and will use this information responsibly, lawfully, and only when necessary for legitimate self-defense.